Surgical and clinical anatomy of the mandible. We will start from development and ossification of the mandible. In the fourth week of intrauterine life, from the lateral and ventral aspect of the cranium, 5 prominences seen around the stomotium. Here stoma means opening. The 5 prominences are 1 frontonasal process, 2 maxillary process, 2 mandibular process. The frontonasal process arises from the proliferation of the mesenchyme covering the forebrain. The maxillary and mandibular process arises from the first bronchial arch on each side of the frontonasal process. The nasal placodes are formed which deeps and forms nasal pits or olfactory pits. Now in this pic, this is the lateral view and frontal view. This represents the 5 prominences, the frontonasal, mandibular and maxillary process. Now, the edge of the nasal pits has raised median and lateral nasal process. The two medial nasal process merge to form intermaxillary segment, which consists of philtrum and premaxilla. The nasal septum, which develops as a downward growth from fused median nasal process. Mandibular process from both sides fuse in midline and form symphysis mentae, lower jaw and lower lip. Maxillary process fuse with lateral nasal process and then with median nasal process to forms lateral part of the upper lip and cheeks. This diagram representing the derivation of the parts of the face. This is a real specimen of a fetus which shows the maxillary prominence, mandibular prominence and the head prominence and cardiac swelling. The median and lateral nasal process also fuse together to cut off nasal pits from future mouth. Thus, this way the right and left nasal pits comes close to each other. The frontonasal process gives rise the bridge of the nose and lateral nasal process gives ala of the nose and fused median nasal process gives rise the crest and tip of the nose. In this pic, we can see how the nasal bridge is formed, the mandibular process, the maxillary process, the philtrum, the lateral nasal process, the premaxilla. Development and ossification of the mandible proper. The greater part of the mandible is ossified in the membrane in the mesenchyme of the mandibular process. The ventral part of the Meckel's cartilage become embedded in the bone. Ossification of the coronoid and condylite process is preceded by formation of secondary cartilage in this situation. This is the developing mandible where the mandibular nerve is formed, which a branch or trigeminal nerve, mandibular nerve. This is on the left side we can see the lingual nerve. The mandible is one of the first bone in the body to start ossifying, being next in this respect only to the clavicle. Each half of the bone is formed from the center of the ossification that appears near the mental foramen during the 6th week of fetal life. Small secondary centers may appear for the genital tubercles. At the birth, the bone is in 2 halves that united at a fibrous joint called symphysis mentae. The 2 halves unite between the first and third year of age. This is Meckel's cartilage, the alveolar nerve, the initial site of